everyone, welcome to today's episode of Licensure Hub. If today happens to be the first time you are joining us, I will urge you to subscribe to our Licensure Hub channel so that as and when we release any new video, you will be notified to follow us accordingly. Our first question for today reads, the patient with osteoporosis had a spontaneous hip fracture. How would the nurse document this before the X-ray results return? A. Open fracture. B. Pathologic fracture. C. Green stick fracture. Our first question is trying to examine our knowledge on fractures. What then is a fracture? A fracture is just a break in the continuity of a bone. We have types of fractures and we have various causes of fractures. Option A is saying that there has been an open fracture or open fracture. What is open fracture? An open fracture is simply a fracture in which the broken bone is in communication with the external environment. So the bone is broken and there's a cut in the skin, and so we can see that the skin is injured and the bone is in communication with the external environment. That is an open fracture. Pathologic fracture. What is a pathologic fracture? Pathology has to do with what? The study of disease. So when we say pathology, we are looking at diseases. And so if a fracture occurred because of a disease, we term that fracture as a pathologic fracture or a pathological fracture. Green stick fracture. Green stick fracture is a type of fracture that is most commonly seen in children. And so any question that is defining a fracture that is commonly seen in children will be going for what? A green stick fracture. Now the question was saying that this patient had osteoporosis. What is osteoporosis? The prefix osteo should quickly tell that is a bone. So osteoporosis is a condition in which the bone is porous. It has become brittle because it has lacked more of what? The mineral salt. So the bone has become brittle and porous and is liable to fracture. And so looking at osteoporosis being a disease causing a fracture, the nurse will document that as a pathologic fracture. So back to our question on the screen, our correct answer will be option B, pathological fracture or pathologic fracture. Because you said that a pathologic fracture is a type of fracture that occurs because of a disease process. And the disease process being mentioned in the question is osteoporosis. That leaves us with no choice than pathologic fracture. The athlete comes to your ward with subluxation. What does the nurse know happens to the tissue to cause pain when subluxation occurs? A. Tearing of a ligament. B. Stretching of a muscle and fascia shield. C. Incomplete separation of articular surfaces of joints caused by ligament injury. The term mentioned in this question here is subluxation. That still takes us back to fractures. Now, what is subluxation? Subluxation is just a type of dislocation in which there's an incomplete separation of a joint. So when you have, for instance, your shoulder, the ball and socket, when someone is having a dislocation and you go and check, and you realize that there has been an incomplete separation of a joint, that is what we mean by subluxation. Whereas dislocation is the complete separation of a joint, subluxation is an incomplete separation of what? A joint or an articular surface. So a joint is simply where two or more bones meet. And so where two or more bones meet and there has been an incomplete separation because of an injury, that is termed as subluxation. Let's look at option A. Option A is saying that tearing of a ligament. Tearing of a ligament is medically known as a sprain. So a tear in a ligament is known as a sprain, whilst a tear in a tendon is known as a strain. So option A is not part of our answer. It's not part of what you are looking for. Option C is saying that incomplete separation of articular surfaces of joint caused by ligament injury. Yes, this defines what subluxation is. And so the correct answer here is our option C, as defined by subluxation. Our next question. A 32-year-old hypertensive is admitted to your ward for abdominal surgery. During your assessment, you found out that he uses diuretics to manage the hypertension. Which of the following would you report to the surgeon? A. Serum potassium level of 3.3 millimoles per liters. B. Blood pressure of 140/80 millimeters of mercury. And C. Pulse rate of 105 beats per minute. This question is talking about hypertension, where a patient who is hypertensive crisis is back from surgery. What is hypertension and what is hypertensive crisis? Hypertension, which is also known as high blood pressure, is a condition in which someone's blood pressure readings are above normal, are higher above normal. When you look at the systolic reading, it's above 140. If you look at the diastolic reading, it's above 99 or 90. When someone is in hypertensive crisis, it means that the person's hypertension has been poorly controlled and that is above 160 for the systolic and above 100 for the diastolic. That is hypertensive crisis. And if it's not managed instantly, it may bring more problems to the patient, which include death. And so this patient is back from theater, and they are saying that he has been using diuretics to manage hypertension. What parameters in the options that when you, the nurse, notes, you should quickly inform the surgeon? In our previous knowledge on pharmacology, we know very well that when one is using diuretics, he depletes the body of an important electrolyte known as potassium. And so quickly, you should be observing the patient's serum potassium levels. And when you look at potassium, what are the normal ranges of potassium in the body? Potassium ranges from 3.5 to 5.5, which varies across ligatures. But the normal range for potassium can be 3.5 to 5.5 milliequivalent per mole. So when the patient starts having a decrease in serum potassium level, also known as hypokalemia, as a result of the use of diuretics, the surgeon should be notified instantly, because when you lose potassium in your body, you are going to have a lot of systemic complications. It can affect how the heart works, it can affect how your muscles work, because potassium is needed for various functions in the body, such as cardiac activity. And so looking back at the question on the screen, you will see that option A, serum potassium level of 3.3 millimoles per liter, should quickly be reported to the surgeon. Option B, blood pressure of 140/80, will be considered normal for someone who is hypertensive. And then option C, the pulse rate, which is a bit higher, but will be considered normal for somebody who's already having hypertension. That leaves us with no option than to choose option A as a correct answer. Next question. Master John say 16-year-old report to the OPD with an inflammation on the left foot after he sustained an injury during a football match. The cardinal signs of inflammation include A. Pain, edema, pus formation, pallor, decreased nerve supply. B. Heat, redness, pain, swelling, loss of function. C. Heat, pus formation, pain, swelling, loss of sensation. This question seeks to question us on inflammation and what its cardinal signs. What then is inflammation? Inflammation can be defined as the body's natural response to injury. For instance, if I hit my hand against this structure, inflammation will be triggered. My body will respond to that injury. That is what we mean by inflammation. According to a scientist called Vekol, he propounded some 5 main cardinal signs of inflammation, which was propounded in Latin: rubor, which means redness; calor, which means heat; dolor, which means pain; and then we have tumor, which means swelling; and we have functio lisa, which means loss of function or loss of impairment, as projected on your screen. These are the 5 cardinal signs of inflammation according to Vekol. In surgery, these are the cardinal signs that we expect to see when inflammation is going on. And so interpreting these Vekol Latin words, you will see that rubor means redness, calor means heat, dolor means pain, tumor means swelling, and functio lisa meaning loss of impairment. Let's go back to our question to see what cardinal signs will be the most appropriate. Option A will be out because decreased nerve supply will not be part of our answer, as well as pallor and pus formation, and it will not be part of it. Option B, having heat, redness, pain, swelling, loss of function. These are all distinctive cardinal signs of inflammation, making our option B the correct answer in this question. And so the cardinal signs of inflammation is heat, pain, swelling, loss of function are the cardinal signs of inflammation as propounded by Vekol. Our next question: which of the following tests is included in the diagnosis of varicose veins? A. Trendelenburg test, B. Rhine test, and C. Weber test. Varicose vein has been mentioned in this question. One may ask, what is varicose vein? Varicose veins can be defined as defective valves in a vein. So when there is a faulty vein, a faulty valve in a vein, that's what we mean by varicose vein. And if it's mostly occurs at the legs. And so you see the vein bulging out in form of a macaroni or an indomie-like nature. That is varicose veins. That is varicose vein, which is mostly seen on the legs. Now, one of the tests that can be done for varicose veins include the Trendelenburg test. In this test, we are looking at the potency or the competency of the valves in the lower leg vein, specifically the saphenous vein. So a tourniquet is applied to the mid-thigh, and ideally, it will take less than 30 seconds for the vein to refill. And so if it is taking a longer time for that vein to refill after the tourniquet is removed, then we say that this valve has lost its competency, hence is diagnosed as varicose vein. And that is what we mean by the Trendelenburg test. Option B and C, which is the Rhine and the Weber test, these tests are done to assess the hearing of a patient, and so makes option B and C not part of our answer, leaving out no option as the correct answer to be the Trendelenburg test. Thank you. Today comes to the end of another episode on our Licensure Hub channel. I will urge all who just joined us to subscribe to the channel, like and share, so that anytime we release a video, you will get notified. You can keep your questions in our comment section and we will respond to them appropriately. Thank you. See you on another episode of Licensure Hub.